All right, ready to go. Hi everyone, thank you for joining me today. My name is Janine Ennis, and I'm a speech pathologist at Health Sciences Center in Winnipeg, and I work in the voice clinic. I'm really excited to be here to talk about voice information for fitness professionals. It is the voice is a very exciting thing to me, obviously, because I've decided to work in that area. But the reason it excites me is because it's primarily a muscle, and that muscle can be injured and strained and fatigued just like other muscles. And I think from a fitness professional's perspective, you can understand how we need to take care of all the muscles in our body, including our vocal cords. So that's what I want to talk to you about today, to give you some information about how to take care of your voice and how to figure out if something's going wrong. I'm just going to try to move my slides. 1 second. Okay, thank you. Often we ask questions of people who come into our clinic, and there are things like, do you develop bouts of laryngitis frequently? Are you frequently prescribed antibiotics for sore throats or hoarseness, and those medications don't seem to help? Do you have a sore throat or a hoarse voice by the end of the day or the end of the week? Is it an effort to speak? Or do you have trouble speaking loudly or softly? Or does your voice tire out on you? Does it fatigue? See what's happening here? There we go. I just have to get my cursor on there. So if you answered yes, you may be experiencing symptoms that are common for people in vocally demanding jobs, which fitness professionals often are. These are signs of vocal abuse and misuse, and these are complaints that are preventable. I thought I'd start off with a video. So for those of you who are able to see it, I hope this is of a benefit to you. It's a video of the normal larynx or voice box. In the middle is the two white curly vocal cords, and you'll see how they operate, how they vibrate together. The vibrations have been slowed by a stroboscopy light, and the person who has passed the camera in through the nose of the individual and is looking down at the vocal cords is giving some instructions on different types of vocal maneuvers to do. So I hope you find this interesting. You can see when she takes a breath, you can look down into the windpipe. The vocal cords are lengthening as the pitch goes up. That's increasing intensity, and you can see the muscles working a little harder. The lower pitch provides slower vibrations. The higher pitch, the vibrations happen faster. I'll just stop it there because you kind of get the idea, but that's what the normal voice box looks like, and that's what happens during an examination with the doctor. They take a look at what the vocal cords are doing when you're making different sounds. Today's presentation is going to introduce a variety of things. Some may seem very familiar to you, but we'll put it all together. So we'll talk about the basic anatomy. We'll talk about what can go wrong with the voice, how to tell if things have gone wrong, how to prevent things from going wrong, and then if it ends up being that case, what to do if things have gone wrong. I was looking through the literature to see if I could find some information on fitness professionals and how the voice is impacted in their particular jobs, and there really isn't much out there. But luckily, just as I was putting this presentation together, there's a Journal of Voice, and they published an article on group fitness instructors. So I thought it would be pertinent to put it in because it is the most recent type of literature that we have out there, and it is the only study of its kind at this point. So basically, they did some studies in the 90s with aerobics instructors, and then not much happened between then and now. So This particular study was done in Australia. They surveyed the number of 361 group fitness instructors, or GFIs, on the slide. There were 81 males and 280 females. So they surveyed these folks, a very large number, so it's a good amount of people to get data from. And they tried to figure out how common are acute and chronic voice problems based on self-reported data. And what they found is that acute problems are happening in 78% of the people, and chronic, which means at least happening for 3 weeks, problems are happening in 70% of the groups, 70% of the sample. Partial voice loss and hoarseness were the most frequent complaints, and that happened in almost 60% of the people who were surveyed. And that's pretty startling information. And the alarming part is that if you boil that down, it's more than half of the respondents had symptoms of chronic voice change. And that's the kind of thing we want to try to prevent and educate about. So this study also asked people, where did they get any education about their voice, and where did they get their education from? Most people, 30% of the people said that they had received some formal education about voice health, but that information came from people in the fitness industry and not from voice professionals such as speech language pathologists. So only 30%, and that's certainly a number that could be improved upon. But they concluded that voice problems obviously do represent a significant occupational hazard for group fitness instructors. And that's not very surprising to anyone listening, but it's very good to have that documented and have some numbers associated with it. They also reported that speech language pathologists and other voice professionals should consider taking a really proactive stance in understanding the vocal demands of this type of profession. And that absolutely is true, and we probably don't do enough to do that. And finally, the instructors, the group fitness instructors, need to be engaged in voice education to prevent both acute and long-term or chronic voice problems. So I do want to talk to you a little bit about how the voice is produced. Some of this may be things that you already know. I'll first talk about the anatomy and the physiology. The vocal tract is how we make our voice. It's broken up into 4 distinct systems. The first part is the respiratory system, which is composed of the lungs and the diaphragm. The second part is the phonatory system, which is composed of the larynx. The respiratory system is the pharynx, which is the throat, the oral cavity, and the nasal cavity. And finally, the articulatory system. That's comprised of the lips, tongues, teeth, cheeks, and palate and jaw. Here's a bit more of a schematic design of how this system works. You can see the muscle force is pushing up from down below. That's the diaphragm. It's compressing the air out of the lungs through the vocal cords and causing them to vibrate. It's really an open tube system, as you can see at the end of the diagram where the output is. There's really not much getting in the way of the sound. So those sound vibrations travel through the throat and the pharynx, over the back of the tongue, and then it decides which way it's going to go. Is it going to be a nasal sound or an oral sound? And the air and the vibrations will be diverted appropriately. So let's break it down. The respiratory system. We breathe about 22,000 times a day. More so if you're a fitness professional, I'm sure, and if you're doing fitness, this is just sort of a ballpark amount for at-rest breathing, but that's a lot of frequency. The diaphragm is responsible for the majority of that breathing effort. And other important muscles for breathing include the intercostals and the abdominal muscles. The movement of the diaphragm is outlined in this slide here. You can see when you inhale and air goes in, the diaphragm contracts and moves down. That pulls the air down into the lungs. And the diaphragm is like a big inverted, or a big umbrella. Excuse me, it's not inverted, but it's like an umbrella, and it moves down and it moves up accordingly. So through your fitness training, you know how important breathing is and how important it is to a successful workout. Well, that same principle applies to voice. That passage of the air in through the vocal cords and out again with the movement of the diaphragm is very important for support and power for the voice. I often think that the voice is created right there in the throat, but it's that power source of the air from down below that is very important. The phonatory system is the next component of our vocal tract. This is where sound is made. Phonatory means formation or sound. The larynx is comprised of cartilage, muscle, bone, one bone, the hyoid bone, and the vocal cords themselves. I want everyone to take a moment and just place your fingers on the front of your throat and feel when you swallow for a little protrusion that bobs past your fingers. That protrusion should have somewhat of a V-shaped notch feel to it, and that's the part of the thyroid cartilage you can see in the picture. I'll just put my little cursor there. This is the thyroid cartilage right here, and there's the V-shaped notch. When you locate that V-shaped notch on the front of your throat, just behind there is where the vocal cords are seated, and that's the larynx. The thyroid gland is down below. It is the pinkish sort of gland right here. That's where people have surgeries or have treatments for thyroid problems. The cartilage itself is the protective mechanism. It's a shield for our vocal cords and offers some protection and housing to them. Again, here's a picture of a normal larynx. The vocal cords are pearly white, which is how we want them to look in terms of color. Down below is the trachea or the windpipe. You see the rings of the trachea down there. And these are the extrinsic muscles of the larynx surrounding those vocal cords. There's two components. There's intrinsic muscles of the vocal cords themselves and the extrinsic muscles, which assist with making sound, but they don't create the sound. And I want to draw your attention also to just behind at the back of that picture, right at the bottom of the screen. It's a little bit cut off here, but right where my arrow is, if you can see that, is where the food is transported to when we swallow. So food can go down the wrong pipe. You can see where, if that's where the opening to the esophagus is, just behind the vocal cords, there's a chance for things to go the wrong way. But we have protective mechanisms. So our vocal cords close, we have a cartilage that flips over top of our airway, and then that tube, which sits closed, will accept the food and pop open and allow things to go down to the stomach. So why do I bring up that particular part? Well, it's because we're going to talk about it a little bit later when it comes into play with things such as acid reflux or indigestion, because the location of the top of the esophagus is so close to the muscles of our larynx and our vocal tract. We need to understand what that proximity means. So again, and I'll say this a few more times, the vocal cords are primarily muscular. In fact, just looking on the internet the other day, I found a website that was for singers, and it indicated that the vocal cords are not made of muscle. That's not true. Don't read that stuff. The vocal cords are primarily muscular. They change in length and tension, and that changes the pitch. We saw that on the video at the beginning. They vibrate 80 to over 800 times a second. That's per second. They hit together or they collide together. And that's what makes the different pitch sounds. It's also called a hertz. Every vibration is called a hertz per second. Vibration per second is a hertz or a frequency. And changes in the impact, how hard they come together, will change the quality of the voice. So if I hold my vocal cords very far apart, I'll be breathy. If I hold them very tight, I'll be strained. If I hold them normally, my voice will come out easily. If I hold them stiff but apart, it's distant. And of course, if we put them very tightly together, it'll be loud sounds, which I'll refrain from doing on this recording. The respiratory and articulatory systems sit above the larynx. These are the parts that shape the sound and the quality of our voice. And the sound that we make from the voice box is changed into speech using the articulators. So that's the tongue and the lips and the teeth and so on. It's a really dynamic system, but any part along the vocal tract can impact how your voice works. And that's why we talk about each of these individually. I'd like to now get into talking a little bit about what causes vocal difficulties. Get into that in a little bit more detail. Vocal difficulties are caused by short or extended periods of vocal abuse and misuse. Vocal abuse is what you do to your voice. The screaming, shouting, being at a concert and cheering all night. Vocal misuse is how you use it on a day-to-day basis. Maybe you're sick and yet you show up and you teach a class and you push your voice through the class in order to get through it. Maybe you're talking very much during the day. You teach your classes and then you do some telephone work or volunteering at the end of the day. That too much talking is a misuse. We have a model that kind of explains how vocal difficulties happen, and it's called Hillman's model. It starts off with normal function. We all start off with normal function, but then something happens to cause vocal fatigue in your mechanism. The voice gets tired. Maybe you get sick. Maybe it was a particularly busy day at work. If we don't do something to reset the voice, rest it, and get it back to normal function, we will continue to talk in that fatigued state, and the muscles will start to learn behaviors that will eventually transition into edema, which is swelling, and tension, so excess muscle tension and overaction inside the mechanism of the larynx. Again, if we don't change our behavior and get it back towards normal function, we're going to continue further down this roadmap towards muscle tension voice disorders. And you can see that persistent swelling and tension will cause us to have to work harder to talk and push to get our voice out. And that's when we get into the point where changes, physical changes happen to the larynx, and we develop things such as nodules and polyps. Those are lesions. So we need to reduce that hyperfunction, that overdoing, and the trauma that we're putting our larynx through to try to get back to normal function. Nodules and polyps are much harder to get back to normal function. We want to stop that roadmap before we get that far. Symptoms to watch out for. These are especially important in jobs where people have a vocally demanding role. So let's go over them now. Voice loss, obviously a problem. A breathy, hoarse, or raspy voice quality is also a problem. Even discomfort or pain associated with speaking or singing, that is something that we kind of brush off sometimes because we can get by, but it could feel like burning, aching, or even just irritability inside the throat. We might feel vocal fatigue or reduced vocal endurance. The voice just doesn't last like it used to. Those kinds of comments. Voice breaks. That's when your voice is going along just fine, all of a sudden it cracks and does something you're not expecting it to. Loss of pitch range, especially for singers, they notice that they can't hit sounds or notes that they previously could. Even just the feeling of tightness, dryness, or a tickle, those are not normal feelings and they need to be addressed. So let's go over these common voice disorders that can occur to give you an idea of what's going on when we talk about them. Voice disorders of misuse and abuse. Muscle tension voice disorder. So that's the one that we start traveling down on that Hillman's model path. The nodules, which are sometimes erroneously referred to as nodes, that is not the correct terminology, and polyps. That is also something that can be grown off the vocal cord. And finally, chronic laryngitis. We'll start with muscle tension voice disorders. This is when one or more of the muscle sets in the larynx are overactive. When the doctor looks inside to assess for the vocal health, they don't see any visible signs of problems. They might see some overactive muscles, but they don't see any lumps or bumps. People with muscle tension voice disorders often experience discomfort and pain, often on one side more than the other. They have that vocal tiring or fatigue. They can't achieve the same range, and their problems are either intermittent, and they kind of come and go, or they're there all the time. Nodules are a benign growth. They're not sinister, but they are something that happens when you move more down that roadmap of muscle tension voice disorders. The top picture shows vocal cords that are healthy. The bottom picture shows vocal cords that have nodules, where the two black arrows are pointing. They are like a fibrous lump or a callus from the repeated abuses that the vocal cords are undergoing. You can see there's lots of blood vessels in there. They're not the pearly white color we hoped that they would be. These are more common in women. They cause a lower pitch, a harsher, breathier vocal quality, and that voice fatigue. And these are pretty persistent dysphonia, which means that the voice sounds not normal all the time, but it fluctuates with use. So if you go on vacation and you're not doing a whole lot of voice use, your voice improves, but when you get back into work again, it ends up deteriorating quite quickly. A polyp looks like this. It's a benign extension, again, not sinister, but it's caused by trauma, like a very shrill scream or a very harsh vocal abuse. The body starts to produce tissue to protect itself from the area where the contact or the injury happened. It's similar to nodules, but it's only on one side, and these happen more commonly in men. A polyp is not going to be able to be treated with voice therapy alone. It does require surgery. Nodules, on the other hand, if we can catch them early enough, hopefully we can make them go away with voice therapy versus surgery. Chronic laryngitis. This is a term that gets thrown around a lot, laryngitis. This just means long-standing inflammation or swelling due to irritants. You can see in the picture that the vocal cords are red and slightly inflamed. There's an arrow pointing to the redness there. This is some acute inflammation. It says due to prolonged shouting, but it could be due to acid reflux, which is a chronic irritant in the larynx, or chronic abuse, or it could be due to an acute bacterial infection. So that's when you get sick and your voice goes on you, but it comes back after you feel better. So there's two different kinds of laryngitis there. It causes a hoarse voice, a lowered pitch, and vocal fatigue. If you go to see your doctor and he tells you have laryngitis, that's all right, but really you need someone to look in at the vocal cords to tell you for sure if that's what you're experiencing. So because there's not a lot of research out there for fitness professionals, I wondered if we could learn from another vocally demanding profession and try to get some tips from them. And that is teaching. There's many more studies out there on teaching at this present time, and particularly one that has been done by a group through the National Center for Voice. The speech language pathologist there is quite famous, and his name is Ingo Tietze. In fact, I'm sure if you Googled his name, you would find a particular exercise he does with a straw. It's kind of like a vocal warm-up and a cool-down. So he's a very interesting guy, and he explains the exercise quite well. They wanted to figure out how often the vocal cords collide or come together in the day of a teacher. And so first they looked at something a little bit more easy to manage. They looked at 5 minutes of hand clapping. So they had people clap their hands for 5 minutes straight, and they counted the average number of collisions of the hands. So that was about 600 collisions. That's just in 5 measly minutes that your hands are colliding. The vocal cords are moving much more rapidly and coming together much more frequently. In the voice box of a teacher, they said, okay, let's measure how long a teacher's voice is on during the day. What's the accumulated time? And then let's compare it to the frequency, the amount of times those vocal cords are vibrating per second. So they took the average of a female and male frequency. And by using those calculations, the number of collisions and the accumulated time, they determined that there are 1.3 million vocal fold collisions in a teacher's day. So 1.3 million times just in a teacher's day that those vocal folds collide or come together. And if we extrapolate this to jobs for fitness professionals, they are also similar to teachers in the sense that they have to do some very concentrated talking for periods of time. I brought in a picture of a classroom and a teacher using a headset. You can't quite see the headset that she's wearing, but it's not attached to the portable speaker. She's wearing a small battery pack on her waist. The students are very close to the speaker, which you can see is circled with the white oval, and they are not being blown away by sound, but they are getting the sound surrounding them. It's being projected very nicely without her having to strain her voice. And this is a teacher who used to lose her voice repeatedly and hasn't lost her voice in years by using the system. The students appreciate it, the teacher appreciates it, school appreciates it because she's not as blown away as often with voice loss. So I just wanted to show how close that speaker could be to the students. It's not overly loud, but the difference it made to the teacher's vocal health. So I'm going to bring this diagram up a few times. This is the good voice in the middle with several systems that we need to coordinate to support that good voice. And we've talked about some of it already, but we're going to talk a little bit more about vocal abuse at the moment. And vocal abuse It comes down to vocal hygiene. How do we take care of our voice? We take care of our oral hygiene. We do it twice a day. We do it because it's socially appropriate, because we want our teeth to be healthy and our mouth to be healthy, and because it feels good. But how many of us make a concerted effort to take care of our voice on a daily basis? Probably very few. We take it for granted and we don't pay much attention to it until it no longer works for us. So our vocal cords can withstand occasional episodes of abuse, but we need to watch out for the persistent stuff. I'm going to go over a few ways that you may be abusing your voice and ways to save your voice and improve your vocal hygiene. First of all, being dehydrated. This is not going to be surprising to people in the fitness industry. You know and I know that being hydrated is very important, but as it reflects on the vocal cords, if we have reduced hydration, we make thicker secretions, and that takes more effort to vibrate the vocal cords if they have heavy secretions sitting on top of them. We suggest limiting caffeine and alcohol, which makes sense because they're diuretics and they suck the water out of us, as well as to drink adequate amounts of water throughout the day. I'm sure that fitness professionals are doing this, but what I want people to think about is if they're maintaining that hydration during the day, or is it only during exercise or fitness classes? Do you wake up in the morning and the first thing you drink is your cup of coffee and then a glass of water? How are we keeping our body well balanced with hydration? There's the comment that 8-ounce glasses of water a day is what we're supposed to be drinking, but recent studies have proven that there's really no scientific evidence that that is the magic number. Really what we need to do is assess our own water needs, because different sized people are going to require different amounts of water. Different activity levels are going to require different amounts of water. So try to keep your water hydration going throughout the day, but make sure that you feel well hydrated before doing speaking tasks or speaking engagements. Striving to increase your water intake is always good. And the voice likes humidity. This is a picture of a small humidifier. It's attached to a computer, so it operates on a USB plug-in, and it just keeps humidity going in an area where you may spend a great deal of time. You can see how big it is compared to that highlighter there. This is a fairly inexpensive way of providing humidity, but in our dry Winnipeg winters, having a humidifier in the phone can also be beneficial. Irritating your larynx and vocal cords is bad, obviously. You know already that smoking or exposure to smoke will be bad for your vocal cords. But the one I have highlighted here is avoid throat clearing or coughing frequently. Throat clearing and coughing is like an added vocal abuse to your system. If you take your hands and you clap them together and you feel the tingling on the surface of your hands, well, that's what's happening when you clear your throat. It's causing those vocal cords to slam together, unusually hard, and it can be a precipitator to some of the problems that we want to try to avoid. So if you find the need to throat clear, really make sure that you have to do it, first of all. A lot of us tend to throat clear. I did this the other day. I was listening to the phone ring, and I wasn't sure how clear my voice was going to be, so I went before the person said hello, before they picked up the phone. That was an unnecessary throat clear and an unnecessary abuse on my part. I needed to just avoid that, and by avoiding it, I should have taken a swallow, a tiny sip of water. If I take a sniff with my nose and a swallow, that can move some secretions through my throat so that I can avoid that throat clear. None of those things are going to be as rewarding as a good cough, I admit that, but if you can try to delay that cough response or that throat clear response, you're going to kind of keep it away from becoming a habit, which it can very well do, and you're giving your vocal cords a break from that exposure. So if none of those work, do a very gentle throat clear with your mouth closed. Make sure you follow that with a swallow, because if you move some phlegm around, you've got to get it out of the way, otherwise it's just going to fall back down to where it was before. Other things that might irritate your larynx and vocal cords include irritating chemicals or allergens and acid reflux, which I said we would talk about in the near future. And here we are. So acid reflux is kind of a buzzword. People use it a lot. It's talked about a lot. Certain medications are prescribed a lot for it. But let's talk about it a little bit more from a lifestyle perspective. I'll just go back down to the bottom of the slide here. It says what to monitor for. Some people think, I don't experience acid reflux. Well, it's not always the obvious feeling of something coming up into your throat or that classic squeezing, heartburn, commercial Pepto-Bismol guy. It could just be the sore throat sensation. It could just be a bitter taste in your throat or mouth. It could just be a tight squeezing sensation in the throat. It could just be a feeling of a lump in your throat that you just can't seem to swallow down, or sticky mucus that's always there that you can't seem to get rid of. It can just be coughing and throat clearing, trouble swallowing. Those are all symptoms to monitor for. You might not experience the classic stuff, but maybe you're experiencing some of these other things. And if you are, when does it happen? Is it after eating or drinking lots of liquid? Is it during or after exercise, after bending over, after lying down at night? And then you've got to look at what might trigger it. Everybody has different triggers. Not all things trigger all people's acid production to ramp up. Some people are very susceptible to caffeine. Others can be susceptible to gum because of the strong flavors. Some people are susceptible to your father-in-law cutting fresh grapefruits for you every morning over spring break. That was my citrus problem, and it bothered my acid reflux, and I ended up having to really watch what I was eating and temper that acid production. So how do we manage acid reflux and its symptoms? Well, we need to do some lifestyle changes is the first thing. We recommend elevating the head of the bed because at night when our body relaxes, there's more of an opportunity for gravity to allow acid to come up and bother your vocal cords or your throat. So we talked about how close the top of the esophagus is to where your vocal cords are. If you're laying down, gravity kind of lets that stuff have free reign if you're having trouble keeping it in your stomach. So elevating the head of the bed somewhat with pillows, wedge pillows, or something underneath the head of the bed can be helpful. Eating smaller, more frequent meals is good to promote digestion. Do not eat within 2 hours of going to bed. That can be very difficult in our busy lives, but it allows your body to process the food before you lie down. Obviously, maintain good body weight and don't smoke. So I encourage you to monitor and identify any patterns or foods that might trigger your suspected signs of reflux. If monitoring and making modifications doesn't work, then there are medications, and you can talk with your doctor about this, but just so you know what the terminology is, I put it on this slide. Proton pump inhibitors, which have names like Prevacid and Nexium, these ones block acid production completely. They help heal damaged tissues. H2 receptor blockers, they reduce the amount of acid that your stomach makes, not quite as long release, and their names are things like Zantac and Pepsid 18. And then finally the antacids that we can purchase over the counter or at the convenience store like Tums, Rolaids, Mylanta, and Gaviscon. These neutralize stomach acid and provide a really quick short-term relief that you can use on odd occasions. So talking too much and or too loudly, this is certainly a type of vocal abuse or misuse that we need to address. Many of us in vocally demanding professions are in it because we enjoy talking and we enjoy teaching. But this is where you need to remember that vocal cords are muscular, and that kind of overuse can strain your muscles. So here are some things that we recommend to people who come through our clinic. Avoid excessive talking and singing. Avoid the yelling, screaming, and cheering, which is incredibly difficult if you're on a team or you're cheering on somebody you enjoy. But find non-vocal ways of doing it. Avoid speaking too loudly or with an effortful whisper. An effortful whisper can even be straining just by the way nature we hold our vocal cords quite stiff to do it. Reduce the background noise that you have to speak over. Use amplification. I'm going to harp on that a bit more. Schedule those vocal rest periods during natural break time. Rest your voice if you have a break. Use non-vocal ways of getting others' attention. And then the final thing, which I usually say to people, is avoid talking when exercising. And I think for people in the fitness industry, that's not quite so easy to do. So I'll just go back one slide. The role of a speech pathologist would be to help a fitness professional learn how to speak well while exercising, using all the good techniques that they can to make sure that the voice is coming out in the healthiest way possible so that when you're exercising, it's not causing too much strain. And I have a study that supports the fact that when you're exercising and speaking at the same time, it does put added strain and effort on the vocal system. So again, there's a bit more information out there now proving that this kind of work is hard on the vocal cords and needs to be looked after. I was looking online for some recommendations that might have come from other fitness associations or in the web world, and I came across the Idea Fit Association, so it's the Health and Fitness Association in the United States, and they had a little article on how to prevent vocal damage, and I really liked what they did, and I thought it spoke well about things that a speech pathologist would also support. So to reduce the risk of vocal cord damage, they suggest using visual cues, which I'm sure a lot of you do, one or two words coupled with a strong, clear visual cue. Play DJ, they said. That means have easy access to the volume control. When it's time for you to talk, turn down the music. When you don't need to talk, music volume can go up. And get mic'd. Use a microphone, whether it be wireless or portable or something that you have attached to your person. That is going to reduce the risk of vocal cord damage. And finally, talk, but less. Think of cues as written words, and then edit or cull them out to use fewer words. So you have a routine, you have things that you're describing to people. See if you can pare down what you're saying into a smaller amount of words you have to say. So it's just like a bit of a script, and you're modifying your script to make sure that you don't have to use too many words or more than needed anyway. We'll get into reviewing the vocal misuse again. I want you to make sure you're not pushing your voice when it's tired or when you're sick. I want you to avoid singing outside of your pitch range. That puts extra strain on the system. That's also included with character voices. If you're reading books to children and making all sorts of goofy voices, that can be hard on your vocal cords. Warm up the voice before singing or public speaking or teaching a class. And use proper abdominal breath support, which you are all aware of. I want to take time also to mention that we really want to be sure that you're taking an adequate breath. Don't speak to the end of your air supply. Don't breath hold while you're preparing to speak. And try not to release your available air supply before you start to speak. Now, it's much more complicated when you're exercising at the same time. I can appreciate. Another picture of voice amplification. This is a system that's attached to the person's waist. You can see the speaker there, and he's got the headset on with the microphone. It helps people who use their voice extensively or feel vocal fatigue, and it allows you to be heard without pushing your voice. That pushing is not normal. It's not normal to push your voice to make it come out. Some systems of amplification are safe for aquatic areas, such as a system called the Chatterbox Extreme. So again, further to my literature review, it was supported by May Lindley through the Neil John McLean Library at Health Sciences Center, so I just wanted to mention her participation. It was very helpful. She had a difficulty finding many studies, as I mentioned, and many of them were done in the 90s and were based on questionnaire surveys of maybe half a dozen people at a time, and they were predominantly female instructors, so that also wasn't completely representative. But there was a student in 2004 who did a thesis study. She did only study 10 people, but she studied, as I was mentioning, the effect of exercise on speaking. So when people were just speaking and not doing the exercise, there was no increase in effort, and it didn't affect that part of the speaking. When they did speaking accompanied with exercise, her objective measures determined that there was more difficulty with the speaking task, and there was even more difficulty without amplification. So the strain and the effort put on the vocal system increased without the use of amplification. And she used several systems to measure that, sort of objective measures using a computer. She recommended that traditional voice treatment methods may need to be modified to address the respiratory and the laryngeal, i.e. muscular, workloads encountered in the population of fitness instructors. And the typical vocal hygiene teaching is not quite sufficient. And that gets back to what I was saying, where I ask people not to exercise while participating, or sorry, not to speak while participating in strenuous exercise. I don't tell them not to exercise, don't get me wrong. But that advice needs to be modified for fitness professionals. So there's a picture of correct use of a fitness instructor with amplification amplification headset on, and it looks to be wireless. These are pictures I took off the website. This is the incorrect way of leading a fitness class. While this lady may have just got into teaching fitness classes and hasn't had to put herself through a whole lot of vocal strain, she's not using any sort of amplification device, and that will make it more difficult for her participants to hear her and increase her vocal strain. Incidentally, this picture was tagged as the oldest fitness instructor in New Zealand at age 89. Music volume and how it relates to hearing loss is the next thing I'm going to harp on. The American Speech and Hearing Association states that continued noise exposure to more than 85 decibels of noise may cause gradual but permanent damage to hearing. So 85 decibels doesn't mean much, but if I try to put that in perspective, your hairdryer operates at about 85 decibels, your gas lawnmower operates at about 106 decibels, and personal listening devices can be at least that loud. And the advice for personal listening devices is to keep them set to no more than half their capable volume so that you don't cause hearing damage to yourself. That's just an aside. But when we think about this kind of noise exposure and the environments that fitness professionals are often in, they are exposed to a lot of noise. And if you are teaching all day or teaching your classes, and then you do your own workout, and then you come home and mow the lawn, and then blow dry your hair, you can think that there's a lot of noise exposure that folks are getting into their ears as well. So aside from voice, volume is important for hearing and conserving the hearing in the long run. Noise-induced hearing loss is what we want to avoid. Excessive music volume is going to have a negative effect on your voice. It causes people to have to strain more to talk. Excessive volume will also have a negative effect on your client's hearing. So they're being inundated with excessive music volume. If it's over the 85 decibels, it could be damaging. And to continue to harp on this, the excessive volume requires those nearby to increase the volume in their earbuds to create hearing damage and to speak louder over the music, which will lead to voice damage. So even if they're not involved in a particular class, they can be impacted by excessive music volume. Noise-induced hearing loss is a real risk, as is the voice damage. So I looked online for standards of music volume, but I didn't find too much to use as a reference. So if you're not sure, you can get sound level meters from electronic stores and put that in different places where you have to work and assess what the volume level is like. See if there's any changes you can make to improve upon that. So I challenge you. I want you to think about what you can do to save your voice in places that you work. Possibly it's ways to seek out improved aspects such as positioning of yourself or client. Possibly regarding acoustics in the room. What can you change? What can you make better in order to get the sound to the listeners with the least amount of strain? We've already talked about reducing the number of words you need to use to speak in order to teach well, and that's just one suggestion. But it really becomes a challenge in trying to figure out how this works. So good voicing comes from that successful coordination of all the systems. We talked about the reduced vocal abuse, which you can see at the top of the screen. You all know about healthy living. We've talked about abdominal breathing. Relaxing the muscles of the head and neck is just as important as relaxing the other muscles around our body. Specifically, back and neck problems can impact how our voice is working because the voice box is primarily muscular, and then it's also surrounded by muscular. It's kind of like a muscular sling. And of course, good posture, which will support the good breath support and the healthy muscles. But we do need to talk about stress because we haven't touched on that yet. And stress seems obvious, but it does cause changes in our body, and we've got to think about how these changes might impact our voice. So when we're under stress, it changes things in our body, like we start to have sleep problems, and we develop skin rashes or gastrointestinal problems, or GI problems. It may change our feelings. We may become more irritable, more cynical, more down, more self-conscious. It may change our actions. We may overeat. We may eat less. We may start grinding our teeth. We may cry for no reason. All of these things are impacting how our voice works. Sleep problems, irritability, talking in a more cynical voice, all of these things are going to start impacting our voice on top of everything else that we do. Even teeth grinding or teeth clenching can impact the muscles surrounding the larynx. And finally, thinking, forgetfulness or poor concentration. If we're forgetful and we're not concentrating well, we're less sure of ourselves, and that's going to impact how we're using our voice and how it feels. We all need to monitor for signs of stress. Doesn't mean that we're stressed out, but we have levels of stress in our lives. That's just what life is about. And a speech pathologist can help you determine or work out if your voice problem may be stress related or how much is stress related. These are some pretty logical ways to manage stress. Use effective coping skills for you. Identify them, figure them out, and use them. Seek help from professionals, even if this means through employee assistance programs or counseling, what have you. Let's manage that stress. And if we don't have any, let's be very proactive or preventative about it and do mindfulness meditation or things that will help us prepare our body for dealing with stress should we come across it. Back to our systems again. It's the coordination of all these systems that's important, and healthy living is the bottom line. This group knows the importance of healthy living on the optimal function of the body, and that the voice is included within that. So I encourage you to take that very seriously as well and pass that message along to others, which I'm sure you do. This picture we use in our group voice therapy classes. So healthy mind, healthy voice, healthy mind, healthy body contributes to a healthy voice. Getting enough sleep, eating well, staying relaxed, using good posture, and of course managing that stress and anxiety. Don't be the potato chip guy on the couch, gross. Try to be a big, happy, free woman in a white suit to run your work. So, our conclusions and next steps. I really want you all to think about what you can do to take care of your voice in many different ways. So, I'm going to ask you a question right at the end after I've gone through the slides that is something you can send back to get credit for watching this course. But just before I get to that, let's wrap this up. So, conclusions and next steps. If you suspect you may have a voice problem, then I want you to see your doctor if the problem lasts longer than 2 weeks. 2 to 3 weeks would be tops. That would be your family doctor. And your doctor should then refer you on to see an otolaryngologist, or otherwise called an ear, nose, and throat doctor, or ENT. An ear, nose, and throat doctor specializes in the vocal cords, and we'll take a look at them to make sure that they are operating in the way that they should and make sure there aren't any of those nodules or polyps or anything causing you difficulty. And I would encourage you when you're talking with your doctor to let them know you're in a vocally demanding profession and that you are concerned about the function of your voice, because they may try to just offer antibiotics to see if it improves the situation. But it's important to know, for them to know that you're not sick and this has been a problem that's lasted for longer than 2 weeks. So again, if you suspect a problem and if the ear, nose, and throat doctor thinks that voice therapy is warranted, you will be referred to a central intake waiting list for voice rehab with a speech-language pathologist. This is a central wait list for the WRHA, and while it is a relatively long waiting list, it is improving. We're getting through it better and better with improved strategies, not with any improvement in resources, mind you. And if you have coverage and you're not someone who likes to wait, then seek out private therapy as an option. you can check with the Manitoba Speech and Hearing Association, which has a listing of private practice professionals, but you would want to seek a professional who has a specialization in voice. Don't ignore symptoms of vocal strain, hoarseness, or pain. Voicing should not be an effort. Consult your doctor if symptoms last more than 2 weeks. Don't demand more of your voice than you would the rest of your body. This is the most important one. Because our vocal cords are kind of always semi-working for us, even when we're sick, we tend to push them a little bit more than we would if it was an injury to a leg or an arm or a hand for writing, what have you. Don't demand more of your voice. It is a muscle. It needs to be rehabilitated and rested. It shouldn't be strained or abused. So my question for you today is, what can you do to help make changes to improve your vocal health? What can you do in your workplace or even in your home life that would help you to make changes to improve your vocal health? There's many things that we can do, and they're partly in our workplace, but also in our home life as well. It can be as simple as not calling from one floor to the other to tell people that they need to come down to supper, which tends to be one of my problems as well. But really think about what you're doing. Are you drinking enough water throughout the day, during your exercises or outside of them? Are you using amplification adequately in every place that you can? Are you making sure that microphones are working, that batteries are charged, that there isn't feedback coming from speakers? Are you advocating for yourself that if microphone isn't working, are you still going ahead and teaching that class? Or are you finding something to help amplify your voice and not pushing it? So there's many things we can do, but just realizing what our voice can be, or what can impact our voice is the first step. So apply those principles you know about health, fitness, and muscles to your voice, and that's a great starting place. So I want to thank you all for your time and listening. I hope you found this information helpful. I put my contact information here at the end. If you have questions or concerns, you are welcome to call, but if it's regarding diagnosing, if you have a problem, remember to go to your physician. That's the first place to start. You can't see a speech pathologist without having had that ear, nose, and throat doctor assessment first, because we don't know what's going on in there until they tell us, and so that's the step to remember. I think I'm going to now stop the slides and see if I can get you.
Go on in. Yeah,
Okay, I've got Anne.
Yeah.
And Bernadine and Karen. All right, I think I can hear you, a couple of you, and I can see a couple of questions coming up. Does anyone have any questions at the moment?
Not really.
Okay. Looks like Karen has left, so if there's anything else, you're welcome to give me a call. Otherwise, thank you very much for joining me today.
Okay, thanks very much.
Thank you.
Okay, bye.
Bye. Thank you for listening.